All right, let's now shift our attention to what else is happening. Now, many would in fact argue that the United States is already facing a health emergency. But according to the U.S. Congress attending physician Dr Manohan, this is just in fact the beginning of the crisis. He says, and these are the figures that has been put out by him, he says that anywhere from 70 to 100 million Americans, that's over 50% of the American population, could end up getting infected by the coronavirus infections. Now, to put these numbers in perspective, America's population is about 327 million people. And if doctors' projections hold, then more than 46% of America's population could actually end up being infected. And these figures were quoted by multiple media agencies in the United States, even before Dr. Bryan had made his remarks. Now, the numbers were presented to Anthony Fauci, the head of the Infectious Diseases Institute and one of the leading immunologists in the world. He has warned against believing in such predictions since they are based upon certain rigid assumptions that may perhaps not factor into account that the number of infections will at a point of time will plateau out. Now, going by Dr. Bryan's model, it is being said, and all of this is of course projections which may not actually work out. And this is what he is predicting at this point of time on certain models that he has worked out. He says that there could be anywhere about 700,000 deaths in the best case scenario in just the United States alone, and about 1.5 million deaths in the worst case scenario. The focus right now is on testing. Can the United States implement universal testing like what was done in South Korea? The Vice President Mike Pence claims that more than 1 million test kits are presently available on the ground. But the Center of Disease Control has contradicted the Vice President, saying that the testing kits actually lack the reagent that is needed to activate it. There are also reports of patients being denied tests despite showing clear symptoms of COVID-19. So how exactly is testing being done in the United States? Well, we'll let Dr. Nick Spano from Boston tell you his experience at a testing station.
Had a mask on as recommended if I had any at home, and I was greeted by a nurse who was the only one in direct contact with me. She had essentially a proper contact precautions with the N95 respiratory mask, the same mask we use to prevent against tuberculosis. And I was then instructed to roll down the window. I was given a nasopharyngeal swab. It was a very thin swab, the same one that we use in the hospital to evaluate for the flu. And this swab essentially goes into your nasal cavity and will reach actually the back of your pharynx, why it's called the nasopharyngeal swab. And she had to do that twice, one in each nostril. One was for COVID-19 and the other swab was for our standard respiratory viral panel. And then she performed a oral swab, which went to the back of my throat. All these swabs are very uncomfortable. Now I know what patients mean when they tell me that they do not want a flu swab done. It's very, very uncomfortable, but obviously it needs to be done. And then I was given a discharge sheet of information with some general information about how to quarantine myself, and I will be receiving a phone call from the Department of Public Health of Massachusetts to be given my results of the test.